Good afternoon, everyone. Can you hear me? Can someone confirm? Hello? Can you all hear me? Anyone?
Yeah, good afternoon. We can hear you.
Hi,
Good afternoon.
madam. Good afternoon, madam.
Good afternoon.
So welcome to the today's webinar, and we are very happy to see that young and enthusiastic participants. So many participants are joining still. So in the meanwhile, I thought that we should start some of the pre-talk activities. So today's agenda is to let us start with the prayer. Let us pray Ma Saraswati, because this is the first event we are again hosting in this year after the last conference. So after the grand success of MPS-CON 2026, we are resuming our webinar activity through this webinar. And again, this will be the most important occasion to remember for all of us, so that we enjoy and cherish the memories. And when we go for the MPS-CON 2027 at Chandigarh, this will be the first event photograph that will be placed in the list of events that are conducted. So that's why this will play a very important occasion for us. And before going into any talks, let us pray Ma Saraswati with a small prayer song. Let me share my screen. Okay, so with the blessings of Ma Saraswati, we are starting today's proceedings with the introduction to the awards which we are going to give during MPS-CON 2027, which will be held at PGI Chandigarh. And we have the privilege at the society, Medical Pharmacology Society. We have established a nice procedure where we can recognize the talents, the contributors, and the most important, pioneers in the field of pharmacology, where it's our responsibility to celebrate their contribution to our profession, to give the dues from our side, because I would like to mention here that we are all benefited because pharmacology, I call because the pharmacology is the mother of all of us. And I also, if I go back to the history, even I would like to say here that pharmacology is the first subject that came into the picture in the whole medicine. And any one of you, if you remember, if anything happens, first comes the treatment done with drugs. So you need to have drugs before treatment. So it is written in the literature that the first subject to get introduced into the field of medicine is pharmacology. And it is the mother of every branch that is existing today. So once we have pharmacology, then people started thinking about diseases, pathology, then the anatomy, physiology, everything, they started getting branched from this pharmacology. And we are very proud that we are the pharmacologists and we are blessed by our pharmacology. So Aushadha is the treatment for every disease, and we propagate the knowledge what we gained through this pharmacology to our medical scientists, our clinicians, our students, and everyone out there. So it is our responsibility to recognize the important contributors to this field of pharmacology. That's why at MPS Medical Pharmacology Society, we have good number of awards that are available. Let me just introduce one by one so that you will get an understanding that so many opportunities are there. So whether you are a senior pharmacologist or you are just a fresher and started contributing actively to the field of pharmacology. So you can see here we have the first award, that is MPS-PS. Okay, MPS Most Promising Senior MD Pharmacologist Award. Okay, MPS Most Promising Senior MD Pharmacologist Award. So what are the eligibilities? You just have to click here. I will be sharing this brochure. So you just have to click here and then learn more about this. Okay, so are you able to see? Are you able to? I think you are not able to see. Just.
Yeah, not yet.
Yeah, I think share screen is not shared. Let me just. Yeah. So you can see here we have, this is the brochure that is available, and I'll be sharing this after this meeting is over or during the meeting once my talk is over. So you can see that MPS Most Promising Senior MD Pharmacologist Award. So you have to click here and you will go to the form, and the eligibility criteria, everything is written here and in the link. Okay, in the link. So you will have to upload important documents that are required. So MPS Promising Senior MD Pharmacologist Award. Okay, so this is what it is, and we are not just speaking, we have already implemented this. In 2024, you can see that Dr. Anand Patil, Dr. Vikash Mehdi, Dr. Shambhu, and so many people. Okay, so we can see here, this is the senior MD pharmacologist, Anand Patil, Dr. Vikash Mehdi sir has been already awarded. So in this 2025, so we awarded Dr. Babul Besbarwa sir, then Dr. Melvin George, and Dr. Prithpal Singh. Then in 2026 latest conference, we awarded Dr. Jayashree Madam, then Syed Ziaur Rahman sir, and Syed Shahnaz Ilyas Madam. Okay, so these are the almost 7-8 people. They are already recognized through this award. So please inform your senior MD, known senior MD pharmacologist, so that they can take cognizance of this and they can apply for it. Okay, it's very important that like you should be confident enough and you should contribute to the society, to the profession, and also you should also claim that you have contributed. Because the person who is sitting in Bangalore, how will I know that you are contributing at your place, you are contributing at different areas of pharmacology? So I will not know. So until you apply here, then only we get to know that okay, there is some person who has this so many achievements, and we will get an understanding that okay, this person can be recognized with this award like this. Okay, so please do not shy away from applying. It's very important to apply. Okay, similarly we have other brochures also, you can see here. Okay, so we have again MPS Most Promising Young Pharmacologist Award. Okay, so who are the people seniors, who are the youngsters? I think you will be confused about this. Nothing to worry. So the link that is given, it will give you understanding. See, we are not going by age. Okay, we are not going by age. So what is the criteria? Young means anyone who passed MD pharmacology and within 10 years of their joining this, without after passing, within 10 years of their joining and completing, and like after passing within 10 years. Okay, so if they have significant contribution to the profession, or like if you are very young, okay, start working today onwards. Okay, so I'm sure you will be able to achieve the status of recognition. Okay, so please start achieving right from the day one, so that you can be awarded. Okay, you can see here we have Dr. Shambho Samajhdar sir, Dr. Pulen Sharma, and then Dr. Suyog Sindhu, Dr. Sanjeev, Dr. Priya Shodam, and then Dr. Mukundam, Dr. Akash Gargade, Dr. Chita. So all these people are recognized with this Young MD Pharmacologist Award. Okay, so please feel motivated and please do contribute to the profession. Okay, who is the senior? Senior means the one after 10 to 25 years. Okay, after the MD pharmacologist. Okay, so the person who has started contributing. Okay, so that means who are already more than 10 years to 25 years. Okay, so like that. Okay, then we also have one more award. Let me just open one more. That is related to Lifetime Achievement Award. Okay, so what is this Lifetime Achievement Award? You can see that a person who is being continuously contributing till their retirement. Okay, so who has made significant progress of pharmacology, and also the self-development and contributed at the ministry levels, or books, or like even a torch bearer. Okay, torch bearer to all of us, say that this is the right path to go. Okay, and guiding the youngsters, and a very popular teacher. So like this, like you can have, and who is going to nominate? So generally, like other two awards, okay, like the Young and Senior MD Pharmacologist Award, they are the self nominated. Okay, so they themselves have to come forward and then nominate, and most importantly, all of them need to be member of MPS society. Okay, so the MPS society, they should have achieved the membership and then apply for it. But Lifetime Achievement Award. Who is going to apply for it? Lifetime Achievement Award is given, means the recognition is given to the person who has been nominated by their students. Okay, so here the self nomination does not happen. Here their students or their society members, they will identify that, like, this person is, like, capable, and he has done the work, he has, contributed, and he has significantly advanced the pharmacology. And, like, so we can see that, like, some of the very important people whom we recognized are, like, we have Dr. Ravindran sir. I think all of you agree that Dr. Ravindran sir, he contributed immensely for the development of profession. And today, what you are using, Cal, it is he's the one who developed. And you can see that we have Dr. Pratibha Nadik, Dr. Shantanu Tripathi. They have been, showing the very important pathway to our profession. And I was recognized by the society as a, Pharma Yogi Award. So, like, I felt very happy that, like, I've been working like a yogi, and they have, given the title that Pharma Yogi Award. And I feel that, like, I'm blessed with this kind of recognition, so that, it motivates me further to continue to become more yogi. Okay, so day in, day out, breathe pharmacology, day in, day out, contribute to the development of the profession. So, like that. You can see that there is one more award what we gave is the, like, Dr. Geetanjali madam and Dr. Nihar Ranjan Biswas. They are the, pioneers in our field. Okay, so they have contributed immensely. And Dr. Prakash BM, Excellence Award was Academic Excellence Award was given mainly, like, he is the, contributor right for our society right from the beginning, and he's being a senior person, continuously adapting to the technology, and he is, continuously supporting the development of society and pharmacology, and, unwavering support is continued. So, like this, we can see that a lot of, recognition opportunities are created, and we are really, blessed. Basically, like, being society founders, we are blessed that, like, society is giving opportunity for us to recognize such senior people, such contributors, and it is giving us more motivation that, like, youngsters will take these leads and come forward, say that, yes, this is our society, we would like to take it forward to the next level, and we want to contribute to this development of our profession. So, like this, this is something, which is happening here, and I suggest that all the youngsters to take a note of this, and then spread the words among the groups, different groups, and also interest, encourage the people to come forward to apply for this. Next one is that, like, MPS faculty and PG student research grant. This is another thing, like, which we have launched this year in the MPS Con 2026. We gave away 4 research projects, and especially, like, faculty, young faculty or senior faculty, and PG students who are, like, interested in doing the research, and then they are in need of some grants. And see, grant is not only money; it is also recognition for you, so that, whenever you go and apply for the bigger grants, like any 10 lakhs, 15 lakhs, 20 lakhs, so they will ask you one question: have you been recognized earlier? Do you have a track record of getting the grant and then following it judiciously, and then completing the project, and then publishing? So we, as a society, we have started this, important initiative, so that our youngsters get an opportunity to learn, apply, and we correct them, we recognize them, we, give opportunity for them to, get the grant, and then they can go forward and then, enjoy, because whatever the learning happens here during this process, and they will definitely get benefited, and they will, enjoy the benefit of this, and then apply for the bigger grants, and then go ahead and secure better grants. And so we are not giving very big amount; it's only small amount, 20,000. And also some of the donors are also have come forward. Like myself, I gave 5,000, and Dr. Kulen Sarva volunteered to give 10,000. Like this, additional. Okay, so it's a top up bonus, the bonus grant what we are going to. Suppose 4 grants we have decided. and the 4 people receive it. And if we feel that additional funds justifies the proper completion of the project, and we will be able to give additional 10,000, 5,000, right from the it is coming from the grants. And if any of you are interested to contribute to this kind of ventures, please go ahead, come back and tell us that okay, I'm interested in this kind of grant, and I'm ready to contribute to the society like this. So please come forward, because generosity always, like what I'm saying is, what you give and it comes back to you. Like, see, we started giving from the society, and I'm sure like comes back to us in a good wishes will be there, and our society will grow, and recognition. And most important, what we get is not important, what you get is most important for us, so that like you go and claim to the world that you are a recognized person. You get the kind of recognition what you are supposed to get. That is what we want. And the confidence we would like, we want you to be a very confident pharmacologist, going and telling the world that you are a pharmacologist. Okay, you chose the pharmacology subject by choice. Okay, that's the kind of confidence we want. And we have given links in all the brochures. Please click them, and then understand more about that particular award or the grant or any kind of thing information. And if you have, like, we have been already, so this is a kind of well gelled oiled machine, so you don't need to worry. So we have already the processes to take it forward. And if you are not getting recognized this year, don't worry. You will, like every year, like this, if this is not the the achievements are not sufficient this year, you continue working so that you get your chance next year. Okay, so that's the kind of confidence we'd like to give you. So please go ahead, work hard, claim your award, and come back and tell us that yes, you have achieved some status, and we are very happy to recognize you. And we want you to be a highly confident pharmacologist going forward, taking MD pharmacology, our profession, to the new height. Okay, so thank you so much for patient listening. And now I would like to introduce our today's speaker. Can I go ahead, madam? Hello.
Yes, good afternoon.
Good afternoon, madam. So just now, let me just briefly introduce our today's speaker. So we would like to thank you, madam, for first of all for agreeing to be the opening batsman of this year. So we congratulate you for taking up this work, and also appreciate your support towards this, so that we are able to start today's meeting. And I would like to introduce you, Dr. Rita KH. She's currently working as professor, Department of Pharmacology at All India Institute of Medical Science, New Delhi. And her most important area of research is neuropharmacology and clinical pharmacology. And I can see here that she has so many achievements already. Fellow of National Academy of Medical Science India, FAMS, and then a fellow of Indian Pharmacology Society, FIPS. Then AIMS Research Excellence Award she got already, and Shakuntala Amit Chand Award from ICMR in 2013, and member of National Academy of Medical Science India. And she is also secured CL Malhotra Prize from APPI, and she secured many awards, including Best Paper Oral Paper Presented Award at Third Zonal Conference of IPS, New Delhi. And then she stood first and in honors all professional MBBS examination. That's incredible achievement, madam. Congratulations. So achieving consistently in all professional MBBS examination highest marks is really great, and we are very proud that you are our pharmacologist. So you have chosen pharmacology as your preferred profession. So we are very fortunate to have you. Kamala Devi Patni Charitable Gold Medal for the Best Graduate of the institution in 1994. Associate Editor of various journals, including Frontiers in Pharmacology and Journal of Physiology and Pharmacology. And then 73 publications she has already done, 6 books plus chapters she has contributed. Totally 125 abstracts are published already. And then handled more than 25 research projects as principal and co-investigator, and organized more than 25 workshops, symposia, and organizing secretary of various important conferences. So thank you so much, madam. We are really, very happy to have you in our today's meeting and looking forward for your interesting presentation. So I'm stopping my sharing of my screen. I'm looking forward to hear you, madam. Thank you.
Good afternoon, everyone. And thank you, Dr. Shivmurthy, for inviting me and giving me this opportunity and to present before you. So let me just try sharing my screen. Is my screen visible?
Yes, ma'am.
Okay.
Your screen is visible, but you can make it for presentation, full presentation.
Okay.
Yes.
Okay.
It's perfect.
So,
Perfect.
okay, thank you. So I will be talking on serious adverse event reporting and compensation in clinical trials. A brief on the Indian regulatory perspective. So I'll be talking on a little bit of key definitions, the regulatory framework, the responsibilities of the key stakeholders, the SAE reporting pathway, compensation, and little bit on post-marketing assessment, and a touch on Sugam portal, and finally we will summarize. So just to introduce, we all know that clinical trials, they are essential to evaluate the safety and efficacy of new drugs. And serious adverse events may occur anytime during trials, and they must be reported very promptly. The new drugs and clinical trials rules, the NDCTR rule of 2019, it provides a very clear regulatory framework with an aim to ensure participant protection, timely reporting, and fair compensation. This helps to strengthen the transparency, the ethics, and accountability of clinical research in India. What is an adverse event? So adverse event is any untoward medical occurrence during treatment, and it does not necessarily have to have a causal link to the drug which is being given to the participant. So, and what are the serious adverse event? Any adverse event which results in death, it is life-threatening, which can result in hospitalization or prolongation of already hospitalized patient, which can result in persistent or significant disability or incapacity, and an adverse event which can result in congenital anomaly or birth defect in the offspring. These are all considered as serious adverse event, and all these need to be reported promptly. So any adverse event, just to recapitulate, is any untoward medical occurrence in a patient given a medicinal product. So it did not be caused by the treatment. For instance, if you are participating in a trial and you are crossing a road and you meet with an accident, that adverse event may or may not be related to the drug that you are taking. So it need not be causally related to the treatment that you are taking. Whereas ADR or adverse drug reaction, it is a noxious, unintended response to a medicinal product where a causal relationship is at least a reasonable possibility. That means the drug should have been causing the adverse reaction. There's something called adverse event of special interest, which is a pre-specified event of particular scientific or medical concern for the product, warranting close monitoring and prompt communication. And SUSAR is suspected unexpected serious adverse reaction, which is also unexpected, not in the reference safety information, but this also triggers expedited regulatory reporting. So when does an adverse event become serious? I've already mentioned in my previous slide. So seriousness is not equal to severity. So in this wheel of adverse events that I have shown, there can be severe headache, there can be severe vomiting, high fever, excessive sleepiness, hospitalization, life-threatening death, and disability. So on the right-hand side, these are severe adverse events, but not serious. Whereas on the left-hand side, starting from death, disability, life-threatening, and hospitalization, these are serious adverse events. So not necessarily all severe adverse events are an SNE or serious adverse event. So severity does not always mean seriousness. I told you about the example of headache. A patient with severe headache with a pain score of 7 out of 10, if he or she recovers at home, then this is not a serious adverse event. It can be a severe adverse event, but not a serious adverse event. Whereas a mild SAE, like a mild arrhythmia, which is clinically minor, but it required hospitalization for observation overnight, then this is, though the adverse event is for mild arrhythmia, but it is considered as a serious adverse event. So the 6 criteria according to ICH is death, life-threatening, hospitalization or prolongation of hospitalization, persistent or significant disability, any adverse event resulting in congenital anomaly in the offspring, or resulting in an important medical event. These are serious adverse events. So death, as we all know, is an adverse event that results in the patient's death. So it can be a fatal outcome occurring during the study. It can be from any cause. Life-threatening means that the patient was at real risk of death at the time of the event. For instance, arrhythmia with anaphylaxis with circulatory collapse, sustained ventricular arrhythmias, this can be life-threatening adverse events. And so this category comes into serious adverse events. Inpatient admission or prolongation of an existing hospital stay is also considered a serious adverse event. So a patient admitted overnight, even to observe a mild arrhythmia, is considered a serious adverse event. A persistent or significant disruption of the ability to conduct normal life functions, that is, resulting in persistent or significant disability, is also considered a serious adverse event. For example, a patient of stroke living a residual weakness or permanent loss of vision. Any adverse event which results in congenital anomaly or birth defect in the offspring of an exposed trial participant. It can be a maternal exposure as well as a paternal drug exposure. So this is also coming under the serious adverse events. An important medical event, that means an event that jeopardizes the patient or needs intervention to prevent one or the other outcomes, even without death or admission. So for instance, anaphylaxis treated in a clinic can be considered as a serious adverse event. Seizures, which did not require hospitalization, can also be considered as a serious adverse event. Drug-induced liver injury, bronchospasm needing intervention. These are examples of important medical event which can come into the category of serious adverse event. So, just to recapitulate, severe headache recovered at home, it is not a serious adverse event. Death from any cause is always a serious adverse event. Mild arrhythmia, even if the patient was admitted only for observation overnight, it is also a serious adverse event. Anaphylaxis treated in the clinic and then sent home, again a serious adverse event. Seizures managed without admission, again a serious adverse event. High fever settled with antipyretics, this is not a serious adverse event. And elective pre-planned admission is also not considered a serious adverse event. So any seriousness triggers reporting. So prompt reporting is very, very important in case of serious adverse events. So whenever an event is detected, a serious adverse event is detected, the investigator has to report to the sponsor, the ethics committee, and the regulatory authority, and so on and so forth. I'll come to the timelines in my subsequent slide. So just to recapitulate again, any adverse event resulting in death is life-threatening, results in hospitalization or prolongation of hospitalization, results in persistent or significant disability, results in congenital anomaly in the offspring, or is a medical important event. All these come under serious adverse event. So just to recapitulate, who is the sponsor? A sponsor can be any individual or a company or an institution or an organization that initiates, manages, and finances a trial. So it is not necessary that a sponsor can only be a company. So even an individual or even your own institute can be a sponsor. Who is an investigator? He is a qualified physician or an investigator responsible for the conduct of the trial at the site, at a particular site. And a trial subject is a patient or a healthy volunteer receiving investigational product in a clinical trial. Trial subject, now we call them as participants rather than a subject. So these are the regulatory frameworks which we need to know. The NDCT rule, which came in 2019, this covers comprehensive regulation for new drugs, investigational new drugs, clinical trials, bioavailability and bioequivalence studies in India. This is enforced by the Ministry of Health and Family Welfare. The Central Licensing Authority, CLA, which is headed by the Drugs Controller General of India. The office is in the Central Centers Control Organization. So this Central Licensing Authority grants permission for conduct of clinical trials as well as BA/BE studies. It also approves new drugs for import, manufacture as well as marketing, and oversees the safety reporting and compensation compliance. The Ethics Committee is responsible for safeguarding the rights, the safety and well-being of trial participants. It reviews as well as approves protocol, monitors the trial conduct, analyzes the serious adverse events, and recommends compensations. So our regulatory framework conforms with the ICH, International Conference of Harmonization, GCP standards E6R2, and it is guided by our ICMR, National Ethical Guidelines for Biomedical and Health Research. So just to recapitulate, the investigator has to report any adverse event within 24 hours, and a detailed report has to be given within the next 14 days. The investigator also has a responsibility to provide medical care during and after the trial, and he or she has to ensure proper informed consent processes are in place. The investigator is responsible for maintenance of accurate and complete records. The sponsor implements the quality assurance systems for compliance. It also forwards the SAE reports within 14 days to the Central Licensing Authority, the Ethics Committee, and the institution. The sponsor is also responsible for providing medical management and compensation within 30 days of the order from the Central Licensing Authority. And the sponsor should also ensure post-trial access to investigational drug in special cases. The Ethics Committee, it safeguards the rights, the safety and well-being of all the trial participants. The Ethics Committee has to review the serious adverse events, and it also recommends the compensation within 30 days, and it also conducts ongoing monitoring and periodic reviews. The Central Licensing Authority acts as a final authority on serious adverse event causality and compensation. The Central Licensing Authority constitutes an expert committee for the death and injury review issues. Like for any SAE, it constitutes an expert committee which will review the SAE, and then it orders compensation within 90 days. The expert committee will order compensation within 90 days. And the Central Licensing Authority can suspend or cancel trial if the sponsor defaults in giving compensation or any other trial-related issues. So coming to the SAE reporting pathway, why there is a need of safety reporting in clinical research? First, we have to create a scientific evidence. This is also an ethical requirement, and there is a regulatory need to report the SAEs in clinical research. So to better understand the reporting timelines and the cases and the compensation guidelines, we first go to the case scenario. Suppose this is a lady, a patient named Mrs. Radhika, aged about 24 years. She is a housewife by occupation and resides in Delhi. So she was inducted into phase 3 trial of Cardiovex, which is considered as a new antihypertensive drug. Her health status as during the recruitment was she was a controlled hypertensive patient, otherwise she was a healthy participant. So A serious adverse event occurred. On 1st of January 2000, I have taken a prospective date for ease of calculation. So on 1st January 2026, Miss Radhika collapses suddenly at home. She was taken to the trial hospital, but she was declared dead due to suspected drug-induced arrhythmia. So death of Mrs. Radhika occurred on 1st of January 2026. So what is the responsibilities of the investigator? He has to notify the sponsor and the ethics committee by the 2nd of January 2026. That is, within 24 hours, he has to notify both the sponsor as well as the ethics committee about the death of Ms. Radhika. And the investigator has to submit the detailed report in form CT5, which is available in the CDSCO website by 15th of January 2026. That is, within 14 days, he has to submit the detailed report of the serious adverse event. That is, what has been the cause of death of Ms. Radhika by 15th of January. So these are the timelines. Within 24 hours, that means by 2nd of January, he has to notify the sponsor as well as EC. And by 15th of January 2026, the investigator has to give a detailed report. Now the sponsor has to analyze and forward the SAE report to the Central Licensing Authority and the EC as well as the institution by 15th of January, that is within 14 days of knowledge. So it is the sponsor's responsibility to notify independently, apart from the investigator, to these agencies, that is the Ethics Committee, the Central Licensing Authority, as well as the institution, within 14 days. That is by 15th of January, he has to review. He has to notify. And the Ethics Committee has to review and give causality as well as compensation recommendation by 31st January. That means within 30 days of SAE occurrence, the Ethics Committee has to review and give causality and compensation recommendation by the 31st of January 2026. Because the death had occurred on 1st January and within 30 days, the SAE, has to give the review and give causality plus compensation recommendation. The Central Licensing Authority, the expert committee constituted by the Central Licensing Authority examines the SAE, and the report has to be given by within 60 days. That means by 1st March, the report should be available, and the Central Licensing Authority, that is the CGI, has to order by 31st of March 2026, that is within 90 days, for the final order, that means causality as well as the compensation to the sponsor. So this is the SAE reporting key dates. So the investigator has to notify within 24 hours of SAE occurrence and submit a detailed report within 14 days. The sponsor has to analyze the SAE and forward the report within 14 days to the Central Licensing Authority, the Ethics Committee, and the institution. The Ethics Committee has to review the SAE, provide analysis and compensation recommendation within 30 days of occurrence of SAE. The Central Licensing Authority, it has to constitute an expert committee which will examine the SAE within 90 days and issues the final order within 90 days. That means the cause of the SAE as well as the compensation guidelines. And the sponsor has to pay the compensation within 30 days. That means 90 plus 30 days. Within 30 days after the 90 days of giving the compensation order to the patient or to the first degree relative of the participant in case of death. So this is the flow chart of the reporting timelines for serious adverse events. So within 24 hours, the investigator has to report to the Ethics Committee, the sponsor, and the CLA. And the investigator, the sponsor has to report to the CLA, the Ethics Committee, and everything within 14 days. And the Ethics Committee has to examine and give the report within 60 days. And the DCGI gives a final decision within 90 days of receipt of the SAE. And the sponsor has to make the final payment within 30 days of the receipt of DCGI order. That is after 90 days of the first occurrence of SAE. Within that, and within 30 days of those 90 days, he has to pay the sponsor has to make the final payment. So these are the timelines for the compensation. So this is just a reporting format which is readily available on the website. The patient details has to be there. The suspected drugs, including the generic drug, the generic name of the drug, indication, everything. The drug details should be there. The other treatment, the details of the SAE should be there, and the outcome, whether the patient is recovered or it has gone. Whatever the sequelae, it has to be there, and the investigator details has also be there in the SAE reporting form. So coming to the compensation, how do we calculate compensation in a patient? So compensation covers both medical management as well as monetary compensation. The sponsor must provide free medical care all the time, and the pre-medical care should be continued until injury is resolved or proven unrelated to the trial. So till the time the injury is proven unrelated, the sponsor has to keep giving medical management, and monetary compensation is mandatory for trial-related injury, particularly for SAEs, whether it's injury, permanent disability, or death. The amount is determined using the 7 schedule formula, which I will be coming later in my subsequent slides. And this is enforced by the Central Licensing Authority. And if the sponsor fails to pay the compensation or does not comply, the CLA, the Central Licensing Authority, may suspend or cancel the clinical trial or the BAB study, whatever the trial was there, and the sponsor may also be restricted from future trials. So now coming to the death of Mrs. Radhika, which occurred on 1st of January 2026, and so the compensation to the nominee of Ms. Radhika has to be paid by 30th of April 2026. So these are the different timelines: within 24 hours, within 14 working days, within 30 days, within 60 days, within 90 days, and after 90 days, within 30 days of the order by the CLA, the sponsor has to pay. So if death has occurred on 1st of January 2026, the nominee of Ms. Radhika should get the compensation at least by 30th of April. So these are the timelines for payment of compensation. So again, the same thing, just a recapitulation, I can skip. So how do we calculate the compensation, the quantum of compensation? So we have a formula, B into F into R divided by 99.37. So what is B? B is the base amount, which in our country is fixed as of now as 8 lakh. F is an S factor. So depending on the S, you will have a factor there. I will show you the table. And R is a risk factor again. We have a table also. So it starts with 0.5, which equivalent to terminally ill patients, and a risk factor of 4 is given to healthy volunteers. So depending on what is your risk factor, what is your age, and what is the base amount is fixed. So this is how we calculate the compensation in case of any SAE related injuries. So in case of death for this patient, it is B into F into R divided by 99.37. So base amount is 8 lakhs. F for this patient is 218.47. So if you see in the figure, in this table, Annexa 1, she's 24 years old. So as per this factor, for 24-year-old, it is 218.47. F and R is the risk factor. I'm showing you the R factor. So for this 24-year-old, this is 218.47 as per the Annexa table. And these are the R factors or the R value. So 0.5 is for terminally ill patient, where we expect the survival is could be less than or equal to 6 months. 1 is for high risk patient, wherein the expected survival is for about 6 to 24 months. And 2 we give for moderate risk patient, where the patient is suffering from chronic disease with stable condition or moderate survival expectation. 3, we give a score of 3 when there is a mild risk patient like minor illness, comorbidity, or good survival expectation. And 4, we give for healthy volunteers. So these are the R values we normally give in case of compensation calculation, ranging from 0.5, 1, 2, 3, and 4. So in this patient, Ms. Radhika, she was mildly hypertensive. So we put her under the mild risk patient, that is, we give her a R value of 3. So patient with expected mortality more than 90%, within 30 days, it is given a fixed amount of rupees 2 lakhs should be given. So any patient with expected mortality within more than 90%, so a fixed amount of 2 lakhs has to be given. So for this patient, Radhika, So the B into F into R by 99.7 comes out to 52.76, 52,76,640. So approximately 52.8 lakhs is payable to the nominee within 30 days of CLS order. That means by 1st April of 2026, if a death occurs on 1st January, the nominee should get 52.8 lakhs by 30th of April. So this was in case of death, which was 52.8 lakhs. Suppose rather than death, she gets into a permanent disability. So this Radhika, patient Radhika, she developed drug-induced cerebral hemorrhage. She was hospitalized for 3 weeks. So outcome is she survives, but left with right-sided hemiplegia. The medical board examines and gave a certificate of 60% permanent disability. So this patient, Radhika, she ended up with 60% permanent disability after she developed drug-induced cerebral hemorrhage and she was hospitalized for 3 weeks because she has developed right-sided hemiplegia. So as per the compensation formula, it is 0.9 for permanent disability. It is 0.9 into death compensation into disability percentage by 100. So in case of permanent disability, this is 0.9 into the amount that she was supposed to receive. That is, if she had died, then 52,76,640 was the death compensation that her nominee was supposed to receive, and 60% disability. So 0.9 into 52.8 into 60 divided by 100. So the final compensation for the permanent disability, which has to be given to Ms. Radhika for this 60% disability, comes to around 28.5 lakhs. So this is how we calculate the quantum of compensation in case of permanent disability. So for permanent disability, this is a formula: C into D into 90 divided by 100. So C is the quantum of compensation which would have been due for payment to the trial subject's nominee in case of death of the trial subject, and D is the percentage disability the trial subject has suffered. So in case of 100% disability, there shall be a 90% compensation in case of death of the trial subject. Now coming to the third SAE, that is congenital anomaly or birth defect. So this Miss Radhika, she was 24-year-old, enrolled in phase 3 trial of CardioVax, but she was pregnant at the time of enrollment, but this was not excluded during screening. Maybe they missed. So she delivered a baby with a congenital heart defect, a ventricular septal defect. The pediatric cardiology team confirmed that the trial drug exposure was a contributory factor by a maternal exposure, that means teratogenic rates. So compensation, there is a fixed monetary compensation of rupees 4 lakh, that is half the base of the debt compensation. That means half the base amount, that is 8 lakh. So fixed monetary compensation of 4 lakhs should be given, plus lifelong medical management for the child, whether it is for surgical correction, follow-ups, rehabilitation, and ongoing care as required. So the sponsor has to provide lifelong medical management for the child, whatever the medical management, whether it's surgical correction, any follow-ups, or rehabilitation, or even physiotherapy treatments, or ongoing care as and when required, apart from the fixed monetary compensation of 4 lakhs. Now coming to the next scenario, that is hospitalization because she developed a life-threatening SAE. So this lady, Radhika, who was enrolled in phase 3 trial of CardioVax, she suffered drug-induced angioedema with airway compromise. She was hospitalized for 10 days in ICU with intubation, but she recovered fully after this and she was discharged. So the classification of serious adverse event was hospitalization, which was life-threatening. So for compensation for hospitalization, we have 2 times the daily minimum wage plus the number of days hospitalized. So that there is a fixed daily minimum wages as per the daily minimum wage rule for every state. It will be different from many states. For Delhi, I have given you a table for 2025. So she was an unskilled worker. So the total minimum wage for her was 710. So the number of days she was hospitalized was 10 days. So 2 times the daily minimum wage into number of days hospitalized. So her quantum of compensation comes to 2 into 710 into 10 days, which was number of days of hospitalization. So the compensation amount was 14,200. Plus, she has to be provided free medical management by the sponsor during hospitalization until recovery. So anytime a patient is hospitalized for a life-threatening SAE, then this is the quantum of compensation. So it will depend on what type of worker he or she is, whether it's skilled, unskilled, or semi-skilled, and the number of days hospitalized. So this is how we calculate the quantum of compensation in case of hospitalization. Just to summarize again, for that, formula is B into F into R by 99.37. The 99.37 figure comes from that appendix, the S vector, and this is for 65 A's to above. B is the base amount of 8 lakhs, F is the S vector as per Annex 1, and R is the X vector, 0.5, which is terminally ill, and 4 for healthy volunteer. For permanent disability, 90% of the death compensation in 2% disability. For congenital anomaly, it is half of the base amount plus lifelong medical management if needed for of the child, and hospitalization or life-threatening or reversible SAE 2 times the daily minimum wage plus number of days hospitalized. So this is how we calculate the quantum of compensation, and it differs as per the SAE that has occurred on that particular patient. So there is a causality assessment also for SAE. It can range from certain, which is a strong association, indicates a certain causality, probable or likely indicates a high likelihood of a causal link. It can be possible, which is a potential connection, unlikely, conditional or unclassified, and unaccessible or unclassifiable. So how do you calculate, how do you determine the causality? This will be a separate webinar. So depending on that, it can be certain, probable, possible, unlikely, and unaccessible. So whenever an SAE occurs, whether it's death, life-threatening event, or hospitalization, or persistent disability, or congenital anomaly, whenever the SAE is related to the trial drug or the trial product, whenever it is related, the participant has to be given compensation. So this was about compensation and SAE. So what is post-marketing assessment? So phase 4 trials are sometimes conducted post-approval under protocol to study the additional safety, efficacy, dose response interactions, and this must also follow GCP compensation as well as ethics provision. The post-marketing surveillance or observational studies, they are real-world monitoring, non-interventional. These are conducted under approved protocols and patients treated as per routine practice and prescribing info. And we have a certain term called periodic safety update reports, which the sponsor has to give to the Central Licensing Authority every 6 months for the first 2 years, and then annually for the next 2 years. Extension is possible depending on the central license, on the assessment of the updates, the safety updates. And SUSAs, as we have discussed before, these are serious unexpected adverse drug reactions, and this has to be reported within 15 days to the Central Licensing Authority. And detailed report must be submitted within 30 days after the end of reporting interval. And the regulatory role, the Central Licensing Authority, it reviews all the PMS data, the phase 4 data, PSUR data, and sometimes it may extend the PSUR duration or mandate additional studies if the drug demands. And it also ensures ongoing safety, risks, and benefit monitoring. So we have a SUGAM portal where every investigator has to upload the SAE. So this is an online regulatory portal of CDSCO. So it is used for applications, permissions, and regulatory communications. And there are dedicated modules for clinical trials, BA studies, and SAE reporting. And SAE reporting via SUGAM, the investigator has to upload the SAE notification within 24 hours, and the detailed SAE report should be submitted within 14 days. The uploaded documents like SAE form, narrative, medical records, lab data, death certificate, or autopsy report, if available, should all be uploaded via the SUGAM portal to this online. And the workflow is, after the SAE report, it is auto-routed to the Central Licensing Authority, which is headed by the Drugs Controller General of India, the sponsor, as well as Ethics Committee. And this portal ensures transparency, accountability, and traceability of the submissions. So just to summarize, SAE reporting is mandatory under New Drugs and Clinical Trial Rules of 2019. This is basically to safeguard the trial participants. The timely reporting from 24 hours to 14 days to detail is crucial in SAE reporting, and compensation, as I have discussed, is calculated as per the 7th schedule to ensure fairness and transparency. The Central Licensing Authority is the approving and monitoring authority, and post-marketing safety assessment, whether it's phase 4, PMS, PSURs, it ensures continued drug safety even after the drug is marketed, and the Sugam portal streamlines electronic submission and regulatory communication. So effective SAE reporting builds trust, accountability, and ethical conduct in clinical research. So this was my references, and thank you very much for your patient hearing.
Thank you very much, madam. Now, I think a very nice, excellent presentation, madam. You gave the complete details of. You can stop sharing, madam, if you.
Yeah, that's what I was trying to do.
Yeah. So thank you so much, madam. It was very detailed, and you gave a very nice example how to calculate the compensation, and that was really good, and it was engaging. And if any questions are there, I think please unmute yourself and you can ask, madam, so that we can have we can spend another 10 minutes on a question answer session if any questions are there. Anyone? If you are not able to speak, you can also post your question also. I can read out for you. I can see many of you said good afternoon and informative session. Thank you. Madam, how many clinical trials are now conducted in India, madam? If you have any recent update.
Numerous. Actually, I don't have the actual figure, and because there are different types of clinical trials also. Not all the clinical trials are there in the CDSCO website. For instance, for an academic clinical trial, we don't need to upload in the we don't need to take CDSCO approval. So the count will be very, very difficult to say, but there are multiple, must be in lakhs.
Yeah, maybe I will ask you on behalf of our participants, is there any compensation we need to give for academic trials?
Academic trials, it depends on the protocol, and if you have the facility also, it has any academic trial, it should be mentioned already during the ethical approval and everything that who is going to provide compensation in case of any serious events. So if there is a facility in the institute to provide compensation, then the institute has to provide. Otherwise, in academic clinical trial, which are sponsored by a sponsor, then it is a sponsor's responsibility. But mostly academic clinical trials, we don't have a sponsor, and in some institutes there is a facility for the compensation.
Okay. Suppose nobody gives, madam, no compensation is there, and also objective is to explore the existing treatments. Suppose 2 treatments are there, and we whatever the marketing authorization holders they claim, we think that whatever they claim is not correct. At that time, if we want to try and test from as an academicians, and our objective is purely objective is mainly to do the academic analysis of it. So is there any possibility for us to not give any compensation and still we do the study? Is there any designs we can do so that I'm just asking for the benefit of our participants, so that they may start thinking in that direction also.
Yes. So many times whenever we are writing in the participant information sheet and the consent form, we always say that, in case of any serious adverse event, you will be provided free treatment, but no money will be provided. In case your institute, does not provide, then that clause is always written on the consent form as well as the participant information sheet that this will be all be voluntary. And in case of any serious event, you will be provided free medical care in the institute, but no monetary compensation will be provided. Something like that, you can give a clause.
Yeah, okay. So that is very useful actually, because I don't gain any money and I cannot give any money also.
Yes.
But that should not
So
stop us
that's why you
from,
have to write clearly that no monetary benefit will be given
yeah,
in case of any adverse, and that your ethics committee has to approve that language also.
yeah,
Yeah.
yeah. That is also important because
Yes.
many ethics committees may not agree for it.
Yes. Yeah.
So we'll say that who asked you to do the study, and so patient can be left alone. Like whether whatever. So if you don't have money, don't do the research. Nobody is because the legally as an investigator you will be bound to you need to take some responsibility to ensure
Yes.
that patient is safe at the end of the day, because what at the again the responsibility will fall on the ethics committee, like how did you permit this kind of research, like experimental research where like investigator trialing the treatments. So suppose if the already existing indication, already they have indication is same indication you are trying, you are not doing anything whatever the regulator has approved, the same indication we are trying. So it can be instead of making it a trial, we can make it a kind of observational.
That could be an observational study. Yes.
Yeah,
If you are not
observational.
going to give any intervention, then it comes under observational study.
Observational study, yeah. Prospective observational study.
Yeah.
Oh, so any other questions? I thought.
Yeah.
Yes, ma'am. Please go ahead.
That is safer for any MD student to do rather than even for us. We give drugs also, but then we write that language that this is like no adverse event had been reported, serious adverse event had been reported with this drug. However, in case of any serious event, you will be provided free treatment in the hospital, in the institute. Yeah.
Yes. Okay. So in case of any death, madam, suppose like treatment is okay, but if there is any death,
so you will not do a academic clinical trial which is with a drug which is a potential of causing death, right?
Yeah.
So then it becomes very difficult because if the causality is established, many a time death may occur because of unrelated causes, but if the causality is established, then it becomes very difficult for the institute also. So that's why we as an academician, until and unless we have a sponsor, we should not go in for any new drug which has the potential to cause death.
Yeah. Just it's very important for the investigators to take the responsibility, and the risk what you are taking is should be calculated so that it does not fall on your head, and you should not be in an explaining mode. To someone saying that like I was not intended to do this, it happened like this. So such kind of things should not happen. So we need to take care to avoid such situation where we have to explain to someone. And legally, it will be difficult for us to claim the reasons why you initiated the trials.
Yes.
So
yeah.
Very. Any questions? We are very much interested to understand anything that is coming from the participants. Sukanya is there. Sukanya. Shweta, Shreya, then Nitesh Goyal. Do any of you have any questions? Okay, madam, thank you so much. It was very enriching discussion, and we are really hope that our participants are benefited. Thank you so much for your time and nice presentation. And if you would like to, if you are interested to, again, if anyone is having any questions, they can send it to me, or I can forward it to madam, and we can very well, Anyway, Madam is also there in the group, and she is our member also, MPS Society member. So if any of you are not at MPS Society member, please do join. We are a vibrant society, and we are doing a good job. We are confident that we are going to, amplify our work to the next level. And our mission is to bring, a lot of respect for our profession. I want each one of you to be a respected pharmacologist, so that we proudly say that we are pharmacologists and we are good people. That's the only important agenda what we have here. And I'm sure good means like it is every day, like you are good today, so you become better. So you keep on increasing the grade of good to best, better, whatever like you keep on doing, so that our society, basically society in large, not MPS society, but every human being is benefited, and medical profession grows, and we give very important share of our contribution to the growth of the medical profession. That's the most important thing which we want to do. So please do join MPS Society. Let us do good job, and let us take care. And all of you have a nice day ahead. So enjoy your day. Thank you so much, madam. Before leaving, I have a certificate which I have prepared. I would like to show to my participants before leaving. So let me share my screen. Yeah. So congratulations, madam. Congratulations for completing the first webinar in association with MPS-CDSIMER Center of Excellence Center for Training and Research. We recently signed an MOU with this MPS Society and CDSIMER in association with Dayanand Sagar University, and we have started this webinar, and we will be conducting many more. Thank you for contributing to this noble cause, and looking forward for having many more sessions. Thank you so much, madam.
Thank you, everyone.
Good day. Okay, so good day, everyone. Thank you.